Welcome to our show, Staying Healthy During Air Travel. If flying makes you feel exhausted and depleted, you're not alone. Flying in an airplane can affect your health in many ways. In today's show, we will talk about some of the most common health issues experienced during and after a flight. Usually, the air pressure in the middle ear and the environment is balanced. Even if we went hiking, the rate of pressure change from ground level to the mountaintop is relatively slow. The pace of ascent would give our ears plenty of time to equalize the pressure along the way. But it may be a different story when you're flying. As the airplane takes off and climbs steeply, the air pressure outside changes rapidly. Because the pressurization system of the airplane keeps the pressure steady inside the cabin, the change seems relatively subtle. Inside the cabin, passengers may only experience the climb as if they're driving up a hill. At a cruising altitude of about 9,000 meters above sea level, the air pressure is kept at a level equivalent to what one would experience at about 2,000 plus meters. However, the change of air pressure can still cause ear discomfort in some people. Have you ever noticed that sometimes your ears feel blocked or painful after the plane takes off or starts to descend? A condition called ear barotrauma, also known as airplane ear, happens when the air pressure inside and outside the ear can't be equalized in time to accommodate the sudden pressure change. When the plane begins its ascent, the air pressure inside the cabin also begins to drop. Sometimes, narrow passages called eustachian tubes that connect to the middle ears does not open fast enough. Consequently, the pressure inside the middle ears surpasses the pressure outside, and the eardrums will stretch outward, away from the middle ears. This creates pain in the ears as well as the temporary experience of some level of hearing loss or muffled hearing because the eardrum can't vibrate properly. Here are some tips to avoid airplane ear. You can try to yawn, chew gum, or swallow during ascent and descent. This may open the eustachian tubes to help balance the pressure inside and outside of the ears. Alternatively, use filtered earplugs to help slowly equalize the pressure in the ears. Seek a healthcare professional's advice before flying if you have an ear infection or other medical condition affecting the eustachian tubes. Ear discomfort due to air pressure change may not be the only thing you notice. Normally, a humidity level of around 30 to 50% indoors is fairly comfortable. Flying at about 9,000 meters, the humidity level in the cabin can be as low as 12%, which is almost the same as that of the driest place on Earth, the Atacama Desert in Chile, located over 2,400 meters above sea level with a humidity of about 10%. Thus, we should always remember to drink water during the flight to avoid dehydration. Air sickness, which is a form of motion sickness, is one of the common conditions people experience during a flight. Typical symptoms include cold sweating, headache, dizziness, drowsiness, nausea, and vomiting. It happens when there is a mixture of conflicting signals being sent to the brain from various parts of the body. In the plane, the eyes may tell the brain that we are sitting still as we gaze at the blue sky outside of the window. In reality, a sophisticated network called the vestibular system inside our ears will be able to tell that we are bouncing up and down through air turbulence. The mixture of messages from the ear and the eyes contradict each other and create confusion for the brain. Also, air sickness can be caused by anxiety or strong smells such as petrol. So, is there any way to help us prevent air sickness? Let's check out some of these tips. When booking your flight, try to choose a window seat in the middle sections. over the wings where shaking is felt the least on the plane. In addition to reducing motion-detecting signals being sent from the inner ears to the brain, also try to avoid reading books. You may close your eyes and listen to some music instead. Some evidence has shown that audio signals might reduce your sensitivity to motion signals. If nausea happens to you often when traveling, you may want to eat light food 1 or 2 hours before departing. If we sit in a confined space for a long time, we should always remember to stretch ourselves whenever we can. The reason is that when we sit in a position for extended periods, the risk of developing deep vein thrombosis or DVT also increases. When we sit, our muscles are relaxed and not compressing the veins as much. Thus, the blood is more likely to stay in one area. This increases the chance of a blood clot forming in the deep veins of our lower body parts, such as the pelvis, thighs, or legs. DVT can be potentially life-threatening if the blood clots break free and travel to our lungs, blocking the blood supply, which is known as a pulmonary embolism. Generally, the risk of developing DVT is very small for healthy people. The chance of you getting DVT depends on how long your flight is and whether you have any other health risks associated with blood clots. If you happen to have had a recent surgery, a family history of blood clots or varicose veins, it is worth checking with your physician before taking a long flight. Here are some useful tips to prevent DVT while traveling in the air. Wear loose and comfortable clothes so that they do not restrict blood flow. Alternatively, you may try compression stockings, which can be helpful for people who have an existing condition of varicose veins or chronic venous insufficiency. The compression stockings can put light pressure on your legs and ankles to help push the blood back to the heart. In addition, make sure to drink a lot of water to stay hydrated. Also, try to move around by walking back and forth in the aisles whenever it is possible, such as going for a bathroom break. After long flights, especially those that cross multiple time zones, jet lag is a common short-lived disorder. People often feel sleepy and tired during the daytime and find it difficult to sleep at night. This may lead to a lack of concentration and mood changes. Jet lag symptoms can last for days and even weeks afterward, which can affect your trip. Our body has its own internal biological clock called circadian rhythms that tells us when to sleep and wake up. When our body still functions at the old original time zone that we are from, instead of the new time zone where we travel to, we will experience the symptoms of jet lag. The more time zones we cross, the longer and more intense the symptoms are likely to be. While the biological clock is adjusting itself, some people may experience gastrointestinal problems, such as constipation or indigestion, due to the bowels still working according to their old schedule. Here are a few things you can try to minimize jet lag. Before the trip, rest as much as you can. Gradually change your schedule even before you leave so that it gives your body a head start. During the flight, drink plenty of water to keep hydrated. And you may want to consider eating light meals and limiting caffeine intake. After arrival, find time to go for a walk or do some light exercise outside under the sun. When exposed to sunlight, specialized photosensitive cells at the back of our eye will send a signal to an area in the brain called the hypothalamus. The hypothalamus will then relay the signal to another region in the brain called the pineal gland to reduce melatonin production. The opposite happens at night and close to bedtime. By being exposed to sunlight, it helps set the body's circadian rhythms to the new time zone. Take naps if you feel really groggy, but no longer than 30 minutes each time. Lastly, remember we are still in the midst of a pandemic, so please make sure that you wear your mask properly while you are in flight. We hope today's episode has provided some useful health tips and reminded you of the importance of staying hydrated while you're flying above the clouds.